Hey guys, this is Dr. Ashley with Head to Toe, and today I wanted to talk about low back pain and more of that generalized type of low back pain. So, there's lots of different ways that we can injure the back. There are lots of structures, soft tissues, bones, ligaments, tendons that attach in this somewhat of a tiny area. And the biggest thing, especially recently in the clinic, we've been noticing that a lot of folks are coming in with low back pain that they have no idea where it came from. You know, that type of low back pain where you're waking up in the morning, you're like, whoa, why does my back hurt? And you try to think back to maybe the day before or the week before, and you're like, you know what, honestly, I don't think I did anything to cause that low back pain. So that's where we get the confusion, and that's where a lot of folks are like, how do I fix this? Because I didn't do anything. But little do you know, there's always going to be some kind of aggravating factor, some kind of predisposing factor that's causing your low back pain. There's never a case where low back pain comes on for no particular reason. So oftentimes, while people come in and they say, yep, I woke up with this low back pain, and I have no idea where it came from. So we bring them back into our treatment rooms, and they sit down, we start chatting, and they're like, yeah, doc, you know what? I don't know where my back pain's coming from. I have no idea. They're sitting in this kind of position or something like that. Or they, sit and chatting and they all of a sudden drop something. They're like, yeah, you know what? I just have no idea where it could have came from. And they're just not thinking about their positioning, their movement patterns and things like that could be causing their discomfort. So all that being said, there is something that's causing it, whether you know it or not. The good news is that majority of low back pain cases, especially those that you have no idea what the root cause is that 80% of the time, it's always musculoskeletal in nature, meaning it's coming from the muscles, it's coming from the tendons, it's coming from the ligaments, it's coming from the soft tissues in this lumbar spine, including the discs. So you're probably wondering, well, if it's one of those things, why can't it just go away on its own? What am I supposed to be doing to fix that? Luckily at Head to Toe, we combine a whole bunch of therapies in combination to treat your specific injury. Obviously, not one injury is the same. We don't treat everybody the same way. So depending on what you're dealing with and how you present, we will make sure that we tailor your treatment to you. It's always going to be some kind of combination of manual therapy, working with our hands, chiropractic manipulation, where we're actually adjusting your joints, some kind of movement patterning, and active rehabilitation. So we want to make sure that your movement patterns and the way that you're doing certain things in your daily life, whether it's exercising, sitting, walking, running, that you're doing it correctly. So if you're watching this and you yourself know that you've had some kind of issue with low back pain before, or anybody else that has, please reach out to us. Call the clinic, set up an appointment. We'll make sure that we'll get you assessed right away and out of pain as fast as possible. Again, this is Dr. Ashley with Head to Toe, and we'll see you in the clinic.